Hi, my name is Gabby Qualiano, and today I will be talking about dissociative identity disorder. Dissociative identity disorder, DID, also known as multiple personality disorder and split personality disorder, is a mental health condition where someone has two or more separate identities. People with DID often experience several different personalities, mainly referred to as alters. These different identities can have different behaviors, memories, thought patterns, or expressions, and can have different ways of interacting with their environment. Although these personalities are in the person's body, those memories may not transfer from one identity to another, and sometimes can cause amnesia, gaps in the memory. Things such as stressful experiences, trauma, and abuse can cause DID, and these traumatizing events mainly happen during childhood. DID is estimated to affect 1.5% of people and is considered a rare condition. There are two different types of multiple personality disorder. The first type is possession. Possession identities are presented as if an outside being or spirit took control over your body. This can cause someone to speak or act differently, for example, to have an accent. This identity is unwanted and the switch is involuntary. The other type of DID is non-possession. This identity is less known, and someone may feel a sudden change in self-identification. For example, having an out-of-body experience and almost like you are watching yourself in a movie, not being able to control your speech, emotions, or behaviors. Someone with DID can experience both possessive and non-possessive identities, and it is not uncommon for this to happen. Symptoms of DID are very easy to notice. Having at least two identities that are affecting your behavior, memory, self-perception, and ways of thinking. These different identities can also affect your ability to function in social situations like work, school, and even at home. Having amnesia or gaps in the memory, having a hard time recalling daily activities, personal information, and traumatic events. Some other symptoms that can be found in DID are anxiety, delusions, depression, self-harm, substance abuse, and thoughts about suicide. These symptoms are not always found with DID. Multiple personality disorder is mainly diagnosed by a psychologist or a psychiatrist. They often diagnose DID after taking a detailed medical history exam and learning more about the patient. They can also gather information from people who know the patient best and who have spent the most time with them. In most cases, the people closest to you notice a change in your personality quickly, and that can cause concern. However, there is not a single test that can diagnose DID. Doctors can run exams like a physical exam and a neurological exam. This helps them rule out other conditions with similar symptoms. The doctor may also use different questionnaires like the Dissociative Experience Scale, featuring 28 questions about your day-to-day experiences, the Dissociation Questionnaire, including 63 questions evaluating the severity of the disorder, and many other questionnaires. Symptoms of DID often show up in childhood, ages 5 through 10. However, symptoms at that young of age can also point to ADHD, and because of this, DID is not usually diagnosed until adulthood. DID can be treated by medications to manage your symptoms like depression and anxiety. It can also be treated by psychotherapy. This therapy focuses on working through past trauma, managing sudden behavioral changes, and merging separate identities into a single identity. Someone with multiple personality disorder may face many challenges in their day-to-day life and what they are experiencing. Someone with DID may feel detached from reality or even your emotions and your sense of self. They may also be confused when someone close to them tells them about their behavior, having a hard time remembering what they did when they had a personality change. You can also feel frustrated from this because you cannot remember and are having gaps in your memory. They may also feel stressed because they are not being in control. Someone with multiple personality disorder may also have an out-of-body experience and feel as if they are watching themselves from the outside like a bystander. There are many examples of DID in media. For example, Split, made in 2016, and Sybil, made in 1976. The movie Split portrays someone with DID as a violent antagonist, making many psychologists criticize this movie and say it is a misleading portrayal, whereas Sybil is based on a real DID case and helped introduce the disorder to the public. Movies like Split portray that someone with DID is dangerous and that every DID patient has a distinct, extreme personalities. However, this is not true at all. The media misrepresenting DID allows for a stigma to be created instead of educating. While movies on DID like Sybil give a more positive portrayal for DID, movies like Split that give a negative portrayal does not help the public's perception of DID. The sole purpose for movies with disorders such as DID should be to educate, not to make stigmas. My case study was the article, The Treatment of Dissociative Identity Disorder in an Eating Disorder Residential Treatment Setting. This article explains the co-occurrence of DID and eating disorders in residential treatment. The research involved 18 patients that were diagnosed with both DID and an eating disorder with an average of 32.6 years. For treatment, patients received trauma-focused therapy. This included DID practice guidelines, cognitive processing therapy, and evidence-based approaches. After 8 to 12 weeks of treatment, 15 patients show significant improvements in eating disorder symptoms, PTSD, major depression, anxiety, and just overall quality of life. The study provided proof that trauma-focused, interrogated treatment can effectively help patients with both DID and eating disorders. It also helps show the importance for specialized programs to help and support these patients.